they're very different. Childbirth, if the pelvic floor muscles are traumatized during a difficult vaginal delivery, not only can the pelvic floor muscles be damaged or even torn in very difficult deliveries, but the pudendal nerve, which is the nerve that supplies the sphincters, can be damaged as well. And with time, most of the time, things will reverse and go back to normal, but that is one reason why people become incontinent. And again, obesity. This is something I can never talk about in the office as a cause, of course, because you hate to ever tell anyone that they're obese, but it's definitely a contributing factor. And the force of gravity pushing the extra weight down against the pelvic floor, you can imagine over years will just make that pelvic floor very weak and very lax and not as strong as it should be. Constipation, for the same reasons, rigorous or vigorous contraction of the abdominal weight against the pelvic floor and nerves over time can do the same thing. Not only can it cause impaction or actually pushing up against the bladder neck and actually obstructing the urethra, but even a young person who has chronic constipation and is pushing down on a regular basis can really cause ischemic changes or decreased blood flow to the nerves, and the same thing with the pelvic floor. And again, stress incontinence. Stress incontinence is probably the most common type of incontinence in women. And I always tell people, it depends on how much this bothers you as to how much you're going to put up with to get rid of the problem. I always start with Kegel exercises. Kegel was a gynecologist, I don't know, back in the 40s, 50s, and that's where that name came from. And Dr. Kegel came up with these exercises. And the way you do a Kegel exercise, you don't have to get dressed up. You don't have to put your sweats on, go to the gym. It's just something that you have to remember to do every day. And I try to do them myself every day, so I can't give anyone a hard time because they're very hard to remember. But maybe a stopwatch, or if you have the motivation, if you're having the problem, you will remember to do them, because all in all, I think this is probably the best thing that most people can do for themselves to take care of themselves in the long run, because this is really one of the cures. As to some of these other things are temporary fixes, this is something that on the long term you can have better strength and better control of your bladder. So Kegel exercises, if you're trying to figure out how to do them, if you could imagine if you were urinating and the telephone rang and you had to get the telephone, you had to all of a sudden squeeze the muscle to stop the urine from coming out. Those are the only muscles that you have to use. You don't have to squeeze your legs together. You don't have to squeeze your stomach, squeeze your rectum, anything like that. You just squeeze the muscles that stop the urine flow. After you figure out which muscles those are, don't practice your Kegel exercises anymore when you're urinating, because it will mess up your system, so to speak. After you figure out which muscles to use, we recommend that you do at least 3 sets of 10 every day. 3 sets of 10 contractions every day. And in the perfect world, each contraction is supposed to be held for 10 seconds. But that's very hard to do in the beginning, and with time you'll get more, just like anything else, you get more strength, whatever. So 3 sets of 10. I tell people that after 3 to 4 months of doing those on a regular basis, at least 50% of the people will notice a significant improvement. So all in all, it's free. You can do it whenever you remember, and I think it's a very good idea. Something else, estrogen. Vaginal estrogen creams are an option, or if vaginal creams, suppositories, which have to be put in before bedtime, seem too sloppy or too much of a problem, it usually has to be done 3 times a week when you first start, and then eventually you cut back to once per week. But topical creams are good because they're not supposed to be absorbed systemically. So people who've had breast cancer, of course, we still always have to talk to their gynecologist first, but people who've had breast cancer or are worried about the effects of estrogen, topical estrogen can usually be safely used, is what I think, and I know it's very controversial. Again, if the idea of the creams don't sound very good, there's a new medicine called Estratab, which is a pill that can be inserted into the vagina. It's a little more expensive, but is available. The next thing, if a woman decides or a person decides they're going to be committed to the idea of Kegel exercises, and only after they've decided they're really committed, biofeedback with a trained physical therapist is an excellent idea. Biofeedback is like having your own personal trainer for these issues and can be very beneficial. And I think that since Medicare is now paying for